Now, last season, we ran a competition with Seapoint Clinic, offering one lucky viewer the chance to win a €20,000 smile makeover.
Today we are joined by Dr Thomas Linehan and the winner, Caroline Duffy. But before we reveal the transformation, no smiling out of you in the corner,
no smiles yet.
Because we want to have a quick look at your journey. Fiachar Shaw.
My name is Caroline Duffy. I'm from Tipperary town. I have 3 kids, 2 teenage daughters and a 9-year-old son. I entered this competition because I just didn't have the courage to enter it last year. I didn't have the courage to take a picture of my teeth and for somebody else to see it. Okay, thank you. I smile, but like that, I just want to smile again.
Caroline is a lovely young girl and she has a beautiful smile, but there's a bit of work to be done with her teeth. Caroline's issues are she has some gum disease at the back, probably due to smoking and lack of brushing properly.
I just hated the taste of toothpaste. I just couldn't stand it. It physically made me sick. So not brushing, I'm brushing with water, and it does no good to your teeth. It was probably about 2 years since the last time I'd been to a dentist. It just got to the stage where my teeth got so bad I was just too embarrassed to go anywhere. I had a lot of gum disease. I had a lot of decay on my top teeth, my bottom teeth. Basically, they were just disgusting.
The initial phase of the treatment for Caroline is to treat the gums. The gums are the foundation of everything, and so unless they are healthy, nothing else is going to be healthy above it. So step 1 is really gum treatment. So Caroline has had intensive treatments with the hygienist and the periodontist here. The next phase then for Caroline was to treat all of the decay and any other disease in the mouth. And so we have done all the fillings that needed to be done. She needed to have a root canal treatment as well. There are a couple of teeth that need to be extracted, and she is having some sinus grafts to create some bone at the back of her mouth so that we can put implants in there. And then we are going to do the cosmetic work at the front. We're going to do some veneers to cover over her heavily filled teeth at the front and to just give her that even bright smile. Start to finish, it will probably take about 9 months. It's not a quick overnight treatment. The gum treatment initially is going to take 6 months, but that's going to be a lifetime of treatment. Maintenance is really important when you've got some gum disease. The cosmetic work, I suppose, is probably the easiest, and we're looking at an interim phase of about 3 weeks. So we'll prepare the teeth on the first day and put some temporaries on, and then 3 weeks later we'll have the veneers back from the lab. We'll try them in, see how they look, see how they fit, and if everyone is happy, we'll cement them that day. You see huge improvement in people's self-confidence, and even patients, who've had treatment done, and then you see them on Facebook and they're smiling and they're showing big smiles, and even they'll come in at their review appointments and tell me, I can smile now. I don't have to put my hand up to my mouth. I don't have to keep my mouth closed for every photo and they're beaming. Yeah, it can make a huge difference.
This competition, I think, just has to be the most amazing thing that's ever happened to me. Even now, I'm about 21 weeks into the treatment, and I can just slowly but surely see the confidence rise, and I'm so thrilled.
I think this calls for a drum roll,
yes.
Please. Have we a drum roll? Smile. Hey! Oh, look at that.
Wow, what a smile. You're looking at yourself on camera.
Yeah,
do you notice the difference?
Yeah.
The confidence is the first thing, because you either had your hand up or you were smiling with your top lip covering your teeth. It's unbelievable. Just as we were watching the piece of footage there and Caroline's journey, we're reminded of the last time Caroline was here, and just to bring you back on the whole toothpaste issue, when you stopped using toothpaste, when you were pregnant, you kind of went off the taste, and you continued to just use water. Isn't that what happened?
That was it, yeah. Now it's a completely different story.
Well, obviously.
Yeah.
Thomas will go mad.
Well, Caroline's case is a very common one that we see all day, every day, of somebody who, maybe the picture doesn't look particularly bad, but underneath there was a lot of trouble. And it's so common that somebody in their 40s, might have trouble brewing underneath, but they think, oh, I won't do anything about it. And then all of a sudden somebody arrives perhaps in their 50s, and then they have to face the possibility of wearing a denture for the rest of their lives. So, when we did Caroline's case...
You caught her on time, Thomas, that's what you're saying?
Yeah. Well, there were some teeth that we couldn't save, and we had to replace those with dental implants. For the other ones then, we did a combination of some crowns and some instant veneers to...
What are instant veneers?
Well, there's the technical side of it. We have a team of dental technicians at Seapoint, and we've got some 3D printers that allow us to take nature and to model it exactly. And in one visit, somebody can radically transform their smile. It's pretty amazing.
So this is a 3D thing to take the photo, that whole thing, and then you just create veneers.
Brand new technology, even 3 years ago in dentistry. This just wasn't possible to do.
Yeah, Caroline, were you nervous at the beginning?
I was very nervous, yeah, a very nervous patient, but
Yeah.
I'd nothing to be nervous about.
When was the last time you'd been to a dentist before Thomas?
Probably about at least 3 years.
3 years.
Yeah.
And 3 years is not that long. You know, it is and it isn't. But I think the decay that happened was a combination, Thomas, of probably a bad lifestyle in the sense of smoking and that type of thing. But it shows you if you don't take care of your teeth, brushing and flossing and all that, that you can actually have real problems with dental disease or gum disease.
Some people think that they will lose their teeth because of cavities or that. The most common cause of people to lose their teeth, especially in older life, is because of gum disease. It's because you have perfectly healthy teeth and the gums will give out on them. And that happens underneath the gum. It's very difficult for anybody to know that it's happening to themselves until you find it and treat it. And there are some teeth that we can save, and you know, we try and make those look beautiful, and the other ones we replace with our dental implants. And the fun bit is to make it look like that.
Maura, we were chatting about this before. If you do lose teeth, and I think we spoke to someone a few years ago, the shape of your face changes as well, doesn't it?
And your bite and everything. It's very, it's not just cosmetic. It's actually a physical side, the chewing of food and all that type of thing. Let's just remind ourselves, these are your teeth before. It's a lot of staining and all this type of thing, but look at the difference. So they're very nice and bright and white. Did you give them extra white for her, Thomas, as a treat, did you? Movie star, did she ask for the movie star look?
I would say that that's a perfectly natural colour. We try and look at the whites of Caroline's eyes. We don't try and do anything that's going to be immediately, you know, somebody points out as having white teeth. That's a perfectly natural colour, I would say, for Caroline.
You know what? The first thing you notice, I think, with a bright smile, especially in a woman, is how youthful someone looks if they have good teeth. Do you feel?
If somebody has a confident smile, it's the first thing that you notice.
Yeah, but
about
nice,
them.
white, clean teeth makes you look so much younger. It really does.
Thomas, is every problem fixable when it comes to teeth?
Modern dentistry has solutions that even dentists find amazing these days, like instant veneers and dental implants, just the ability to recreate what exists in nature. There's so many people that we meet every day that think that they have a problem that's gone beyond solving. Somebody who's at that crisis point in their life where they know that they can't chew food comfortably and they think that there's no solution for them.
There is.
There's always solution.
Can I ask you what the story is here with these teeth and these two stained teeth on either side? What's the problem with those two teeth? What happened on top?
This is the magic of instant veneers. We're able to take teeth that we don't like the shape of or the colour of, and in a single day, in a single visit, do these kind of cases.
In one
with people.
sitting?
So
one visit.
somebody can come in and you put the veneers out there and then?
Yes. Yeah,
Really?
we have our own
They can be
lab.
made in the lab within 24 hours?
I promise.
Really?
Absolutely.
That's certainly unbelievable
Thomas,
stuff.
just before you go, for people out there who are kind of nervous and afraid of going to the dentist, can you help them?
Caroline, you help them. Tell them.
Yeah, absolutely.
What was it like?
Amazing.
Any pain?
No.
No pain at all?
No.
Tell the truth.
Tell the truth now.
Couple of stitches.
That's okay.
The pain, but
no pain?
No.
Okay.
Wonderful.
Guys,
Well,
thank you
great
very
to
much.
see you. We're
You
so
look
happy. You
fantastic,
look
Caroline.
amazing.
Brilliant.
Well done.
Pleasure.
Fair play,
Well done.
Thomas. Great to
Well
talk
done,
about this
Caroline.
again. Lovely. So anything we discussed, you can pop on to seapointclinic.ie if you too would like a bright smile like Caroline. Caroline's now the new model.